Today we talk to Dr. Fiona Braka, who is the country representative of the World Health Organization in Ghana. We talk about maternal health and the efforts to overcome maternal mortality. Welcome.
Thank you very much for having me on this podcast. I'm delighted to be part of the conversation around maternal health, which is a very core area of work of WHO as we strive to promote health for all, and that includes women and children and newborns. So I'm delighted to contribute. The role of WHO in Ghana is to provide strategic technical support to the government, and we facilitate the translation of global policies, global best practice, global standards into national policies and guidelines. And these global strategies or guidance has to be contextualized at country level. So we work closely with the government and with stakeholders to translate those global best practices into national policies. So as a technical partner, as a convener, we support the government to coordinate the partnership, to facilitate dialogue around policies and standards. We support institutional capacity building, so workforce training and supply chains and data are all core components of health systems. We support monitoring and evaluation and accountability of programs so that we are measuring the impact of programs, and that we are also building the evidence that can feed into programs. So all this we do in partnership. We promote partnerships, but also we support the advocacy around equity and rights. This is also very important in the maternal health program. So we do all this with our partners, and all this is to try and ensure that women's health is promoted and that we are reaching the targets that have been set for optimal health.
Before we continue talking about maternal mortality in Ghana, could you tell us a little bit about your background working with the World Health Organization?
I was working with our regional office for Africa. It's based in Brazzaville, Congo, where I was with the emergencies program, and I was coordinating the emergency response to disease outbreaks and to humanitarian crises, covering 47 countries in the WHO Afro region. Prior to that, I served in WHO Nigeria for 6 years, where I was leading the polio team, the immunization program as well, more broadly, and really working hard with the government and partners to improve immunization coverage, improve immunization systems within the context of the health system. But a good part of our time was on polio eradication, because Nigeria was the last country with endemic wild polio virus in Africa. There's two other countries, Afghanistan and Pakistan, in the Eastern Mediterranean region of WHO. But in Africa, Nigeria had the last wild polio viruses. So there was a lot of pressure to ensure that we stop transmission of wild polio and that Africa gets certified. So I spent a lot of time on the polio eradication program, and it was a very fulfilling experience. It was challenging but very fulfilling, because through a lot of work, the effort of communities, the effort of traditional leaders, the effort of partners, the effort of and leadership of the government of Nigeria, we did achieve wild polio virus circulation interruption in Nigeria, and the region eventually was certified as wild polio virus free. So this was one of the highlights of my career. And I had also before that, worked in Ethiopia and in my home country, Uganda, in the immunization program. So it's been quite an interesting career path, and I'm glad to finally be here in Ghana, still promoting health, protecting the vulnerable, and keeping Ghanaians safe, as we say in WHO.
What progress do you think that there's been in improving care for mothers and newborns in the country?
So Ghana has made significant progress in improving care for mothers and newborns over the years, and this progress is measurable. There have been surveys. We look at a number of data sources to assess progress. One of them is the demographic and health surveys that are done periodically in countries. So in Ghana, the last one in 2022 showed that we have improved in terms of the antenatal coverage. So there's a high antenatal coverage. The data shows 98% of women have been able to access at least one antenatal care visit from a skilled provider. But overall, when we look at the recommended 4 antenatal care visits, we have 88%, which is an improvement from the last demographic and health survey that was done. We also have seen increased skilled birth attendance as a key indicator. This was estimated at 42% in 1993, went up to 75% in 2014, and by 2022 it's at 86%. So we can see progressive improvement in women accessing a skilled attendant at delivery. And also expansion of institutional deliveries. So we promote safe deliveries within a space that is able to give quality of care, and that you can be able to address any emergencies. So we measure skilled birth attendance, but also institutional deliveries. And from the statistics, we see that home deliveries declined from 57% in 1993 to 13% in 2022. So more and more women are going for institutional deliveries. The other thing is that policies like the free maternal health care, which is under the National Health Insurance Scheme, and also the expansion of services at community level through the CHIPS level, these are contributing to improved access and improved outcomes. So we are also seeing for newborns and children, the newborn care, immunization provision are also improving, and this is improving outcomes for newborns. When we look at maternal mortality, the maternal mortality rate, another key indicator of progress, we have seen it has declined over time. It used to be 472 per 100,000 live births. That was in 2000. But by 2022, 2023, it's at 243 per 100,000 live births. Progress, but it is slow progress, because if we are to reach the Sustainable Development Goal indicators under the SDG 3 on health, we would need to improve, there needs to be an annual reduction. If we are to reach the goal by 2030, there needs to be an annual reduction of 15% every year. But now the annual average over the last decade has been 3.4% reduction. So we need to accelerate the effort towards reducing maternal mortality. And we are noting progress, yes. So we are also cognizant that there are health system drivers that are improving these indicators. We have a lot of effort around workforce capacities, around improving access to care, around referral systems, information systems, and also the environment within which we are operating, and good attention to the area of maternal health politically, and the leadership around it is improving. We are in a good place, and we need to continue that momentum if we are to achieve our targets by 2030. But when we dissect the information more, we see that even with improvement, we do have some disparities. So disparities across regions. So some regions are doing better than others. Disparities between rural, urban settings, disparities around socio-economic inequalities. So that evidence, which is part of what WHO tries to bring, we do dissect the data, we disaggregate, we've done inequality analysis. This information is extremely useful when it comes to designing programs and interventions and guiding where we need to put more focus. So the inequalities in the disaggregation of information is an important point that helps in us being able to invest where the need is needed. So we also have still challenges around quality of care, and also the out-of-pocket expenditures for some of these services. But also happy to say that these financial barriers are being addressed by expanding the National Health Insurance Scheme, the free primary healthcare initiative that the government is launched in April, and that is going to be rolled out over the next year or two in a phased manner. All these are good initiatives that will help us to address the bottlenecks. So good progress, but still work to be done around ensuring equitable access and quality of services.
What do you think, from the World Health Organization's perspective, are some of the key priorities for strengthening maternal and newborn health services in Ghana?
Addressing the inequalities to make sure that we have equitable access. It doesn't matter where a mother is or a child is. By promoting universal health coverage, we also are promoting maternal health coverage as one of the elements to make sure that everyone has equal opportunities. So how we are going to expand services to the vulnerable and remote communities is extremely important. And that's where the free primary healthcare initiative that His Excellency the President launched in April is going to make a difference. The second aspect is on improving quality of care, especially during childbirth, and that in that sense we need to address the health workforce capacities, the promotion of institutional deliveries to ensure that quality services are provided. An analysis done by WHO shows that we still have some challenges in some areas around quality. So that is another key priority that will need to be addressed. The issue around emergency obstetric care and referral systems also is another priority. Being able to rapidly move a mother in delivery with a complication to the next level of care is important. And referral systems are driven by a number of factors. There needs to be, first of all, that signal from the health worker who is or the midwife to know when I need to refer. There has to be a good transport system, ambulance, then also communication in time, the road network. So there's a complexity of issues around referral, but that is also very important for outcomes, especially for women in delivery. I've talked about the health workforce. That is important, not just in terms of skill, but even the numbers, to make sure that we have adequate number of midwives, and these are need to be equitably distributed, especially thinking about the most vulnerable women, and the fact that they need to have access to a skilled attendant. So we need to address the issue of numbers as well as quality. But the other, of course, is also the data systems and the accountability. So how we constantly are tracking information and using it to improve. And that's where the accountability is also important. The maternal death and surveillance response, the audits that are done whenever a mother dies, the need to understand why and what could we have done better. And I'm always pleased to see in Ghana, the death of one person can spark a lot of dialogue around what caused that death, and need to understand where did we go wrong in the system. We encourage that kind of dialogue. It's only by doing these audits that we can trace back and identify where the system failed, and that we can be able to rectify that. So we promote those maternal death audits and documentation, so that we are constantly improving the system. And of course, promoting an integrated primary healthcare system that addresses all the needs of maternal health. So for instance, the free primary health care has a package of interventions which include maternal health. More and more the package will be reviewed and expanded. We need to promote that so that when we access a community, when we access a home, a mother, that we're looking at her holistically and not just targeting something specific around her health, but looking at it holistically. So these are some of the priorities that we see as WHO. The aim is really to ensure that everyone, wherever she is, every mother has an equal opportunity for survival.
Thank you. What gives you hope about the future of maternal health in Ghana?
What gives me hope about the future of maternal health in Ghana? There is a clear national vision. and we have seen the prioritization of maternal health in Ghana. We have seen a system that seeks to understand the statistics, and so where an indicator is lagging behind, there is interrogation of the data to find out what is the problem. And so whereas maternal health or maternal mortality, for instance, as one of the indicators, there has been improvement in the last decade, we see that the improvement is slower than the other indicators. And so there is a clear vision and directive right from the highest level. His Excellency the President has called it out and drawn attention to the fact that we need to do better. We need to do better. And it is also, we are being challenged as partners to think together with the government, bring all the evidence, the expertise around this issue of maternal health. So we have a clear vision, we have a roadmap, we have high political commitment in health, and just also to mention that the strong political commitment has led to the establishment of a presidential initiative on maternal health emergency response. It's a multi-sectoral group that is led by the SDGs Advisory Unit in the Office of the President, and it is co-chaired by the head of the National Development Planning Commission and the Deputy Minister of Health. And so this is charged and tasked to ensure that there is a roadmap and that it is implemented and that we monitor the progress towards reduction of maternal mortality. So it has been taken up as a high priority, and there is accountability. That gives me hope. What gives me hope as well is that there is a drive to address the issues of health workforce. Government has drawn attention to this. We as WHO have supported them to do a health labor market analysis to try and identify the issues around the health workforce. There is a national investment plan for the health workforce, and we know that this year the government has announced that they will be enrolling 16,000 additional health workers, which includes critical workforce around nurses and midwives as well as doctors, and that they are looking at retention schemes to try and encourage the workforce to stay not only in locations that need them internally, but to stay in Ghana, because we know migration is also one of the key challenges. So that gives us hope that the health workforce, which is critical for maternal health, that is in place, and we as the technical partners also will continue to support the evidence generation, will continue to support the capacity building of this workforce according to standards. And so that as well gives me optimism. There's also increasing focus on quality of care and respectful maternity care. So issues around the human rights and the respect for mothers, we are seeing that more and more. And also the use of data and accountability mechanisms. So maternal death audits, the interrogation of data to understand the issues around maternal health. These are initiatives that are being rolled out and being emphasized in the system. So, and finally, just to say that the other hope and positive direction is the strong partnerships that we have here in Ghana. So we have the strong leadership of the government of Ghana, but we also have partners that are working, and the space for us to be able to partner and to give the necessary support is there. So we have a number of technical working groups within the maternal health area of work. There's a working group around safe motherhood, around abortion care, and different aspects that affect maternal health. So these are platforms that partners can come together, that we can share, we can plan together, we can avoid duplication, and that there is coherence around the national vision and plan of the government. So these are positive aspects that do give me hope that if we can keep the momentum and stay focused, that we can reach our targets for maternal health here in Ghana.
Thank you, Dr. Braka, country representative of the World Health Organization here in Ghana. Thank you so much for taking time to talk to us today.
Thank you very much. My pleasure.